Day in terms of COVID-19. Continue with our rolling coverage of the 12 months since our first coronavirus case. With the country's vaccination program in its first phase, we're now looking at inoculation sites to find out how the process is going. Our reporter Mbali Thethani is at the Netcare Milpark Hospital here in Joburg. Mbali, good afternoon to you. How are things unfolding there?
Well, Stephen, it is a year since South Africa recorded its first case of COVID-19, and we know that just last month the government began its process of vaccinating, especially those healthcare workers who are on the front lines in terms of fighting COVID-19. And I must say, where we are right now, it seems as if the vaccination process at the Milpark Hospital has been concluded for the day. But just to give us a bit of insight in terms of to what happens for healthcare workers to get vaccinated, we are now joined by the MD for Netcare, of course, that is Jacques du Plessis. Jacques, we see empty chairs today, and it seems as if everything went well for this vaccine site.
Absolutely. I'm so delighted with the day's events. We vaccinated another 480 frontline healthcare workers that are fighting the epidemic on our behalf. And in the last 3 days, we've done 1,400 vaccinations to healthcare workers. Netcare Milpark is also the site for Helen Joseph Hospital and Wits Donald Gordon, Life Brenthurst, and then Netcare Park Lane, and also Netcare Garden City.
And just take us through the process in which you have adopted for this vaccine site. What happens when a healthcare worker comes in the morning to come and get their jab?
We've got quite an elaborate process. We start off with a simple registration in terms of who the healthcare worker is, ID numbers. There's a band being placed on your arm, and you move through to the administration section where the Sisonke voucher is then verified, and then, as I showed you, you sit into rows, and then you get into this area here, which is where the business of the day happens in terms of the vaccination, and it takes about 6 minutes. Since you sit down here, you then move to the back where there's a 15-minute observation, and should there be any negative reactions, we've got a 6-bed emergency bay that we will be able to accommodate you. Thank God for this 1,400, we had no adverse reactions so far.
And just take us through if you have experienced any challenges in terms of, healthcare workers getting vaccinated, if you have any challenges to tell us about.
I think the only challenge is we'd like to have more vaccinations. As this station is probably running at about 25% usage, and we could easily do 1,000 vaccinations a day.
And just tell us about the response to the vaccination process by healthcare workers. You say that you've done well over 1,000. When it comes to other healthcare workers, are there those who are reluctant? Are you seeing people coming in their numbers? What has the attitude been like from healthcare workers?
Absolutely fantastic. They're all very happy to receive it, and there's no negativity. In fact, we've got more people that arrive that we can help. That's our problem, is really just the number of vaccinations at this stage.
I know that you have concluded the vaccination process, Jacques, for this week. What are your expectations for next week when you start vaccinating more healthcare workers?
So we'll be starting again on Tuesday when the country receives a second batch of roughly 40,000 doses. I don't know yet how many we will get, but as I say, this station can easily do 1,000 vaccinations a day.
And per week, when it comes to those doses, how many vaccinations do you get from government to ensure that our frontline workers get vaccinated?
So it's roughly split that the private sector gets around 30%, and GPs and dentists take about 5%, and the government takes the rest. Clearly the government's got the most healthcare workers.
Thank you very much. Of course, that is Jacques du Plessis just giving us a bit of insight in terms of how the vaccination process has been for the Milpark vaccine site, Stephen. We know that this is still phase 1 of that vaccination process. We do understand that there will be a second phase that will come into effect in April, and we see that more people such as police officials and teachers, they are expected to also get vaccinated. It's back to you.